All right. Thanks, everybody, for joining me in this webinar. So, again, I'm Dr. Japs Lee. I'm an internal medicine provider here at Hudson Clinic with Health Partners. And about a year and a half ago, I did a shingles presentation, and this is an update to that. And I think the most important one really is the new shingles vaccine that's out there that's hard to get because there's a shortage. So we'll go over that as well as what's covered, what's not covered, depending on what kind of insurance you have. So we'll get started on here. So this is about shingles and what you should know. And in terms of the objectives for today, what we're going to be talking about is what is shingles and how do you recognize symptoms of shingles? And what do you do if you do have shingles? What are some of the treatments and preventions that are out there in regards to that? Just a quick overview, shingles is caused by the varicella virus, which is the same virus as the chickenpox virus. About 1 in 3 people will develop shingles, and about half the cases are above the age of 60. So that's why we generally recommend making sure that when you turn 60, we recommend the shingles vaccine, although some insurance do cover it if you are above the age of 50. What is the cause again? It's caused by a virus called the varicella zoster virus. It's the same virus as the chickenpox. Really? What happens is that most kids are exposed to the virus and may end up having chickenpox. And if you've been exposed or has had chickenpox, then you have that virus that's already in you. It's just what causes it to get reactivated, because that virus ends up staying with you for pretty much the rest of your life, but it's just what causes it to become activated. What are some of the risk factors for causing activation of this virus? Majority of the cases, most people are, again, above the age of 60, so we do know that as you get older, your immune system is a lot lower, and so that can be a risk factor for reactivation of the virus. The other is people who are immunocompromised or have a low immune system, and usually those patients consist of patients who have current active cancer, or have HIV, or on certain medications like chemo medications for cancer, prednisone. Some of the transplant-related medications can also lead to low immune system, as well as medications for rheumatological disorders like lupus or rheumatoid arthritis. Other risk factors include stress and people who have had organ transplantation as well, too. Signs and symptoms. Most common sign and symptom is that people may report all of a sudden they may wake up or they have sudden burning, throbbing, stabbing sensation, and they didn't injure themselves, they didn't hurt themselves, they're not sure why they have it. It might be associated with some itching and tingling, and then all of a sudden, a few days later, they notice a rash. This rash is usually located on one side of the body. Most oftentimes, the shingles is located in the trunk region or on the face. You may have blisters related with it, and it may last for about 2 to 4 weeks. So when you have blisters, that means that you're in the most infectious stage because those blisters contain the virus that can spread to other people. So usually at that stage, we usually say try to stay away from people who are young or old or maybe pregnant. It can also, like I say, affect the face, especially the eye. It can lead to vision loss. So really important if you suspect you might have it to come in right away to get evaluated and treated for that. This is just an example of what chickenpox looks like. Usually, again, we see it a lot in younger people or kids. And usually with chickenpox, you can get blisters and scabbing and just a wide array of rash throughout the body. And when we talk about the dermatome of reactivation of that virus that causes chickenpox, that is considered shingles when you have that reactivation. When we talk about dermatome, what that means is that It's a area of the skin that's supplied by a single nerve root. And so usually, again, with shingles, it tends to occur in the trunk region. So that's like your stomach region or your lower back, and then on the face. And again, it's usually on one side. It won't cross and be on both sides. It's very unusual that it would be on both sides or across the entire back or lower stomach or across the entire face. If that's the case, it's most likely not related with shingles. Oh, we have a blank page here. So this is just an example of a typical rash that you might see with shingles. And what you can see here that this is shingles on the trunk. And again, it's located only on one side, so just on this left abdominal area. This one doesn't show blisters, but you can still get shingles without the blisters, and this is what it may look like. Let's see if I can. The other is, this is a picture of what the blisters would look like if you have blisters related with shingles. And again, they look like little small fluid-filled vesicles that may pop open. It may be itchy too. So those are just some examples of shingles. This is an example of shingles that's located on the face. And again, you see that it's only located on one side of the face. So if you see this, only half the nose or the right side of the nose and the right side of the forehead is affected. And here you can see that some of the rash is located around the eye, and the eye is kind of red, and it looks like what we call injected, like there's a lot of discharge or fluid that's coming out. When you see that, we consider that as a medical emergency because, again, you can lose your vision. So oftentimes we may prescribe antiviral medications and have you see an eye doctor right away just to check and make sure there's no eye involvement related with shingles complication. And so that requires actually a very close follow-up. Sometimes when it's involved with the eye, it can also affect the ability for the eyelid to close. And so when that happens, what can happen is that the eye can get really irritated and blurry and can cause a lot of dryness. And so that's why it's really important to see an eye doctor right away to make sure that everything looks okay if you have had shingles affecting the eye. Transmission, again, how do you get that? Usually it's direct contact through blisters. That's usually, again, the most infectious stage. It can also spread to people who have never had chickenpox. So what that means is that if you've never had chickenpox and you are exposed to someone who's had shingles, that initial stage where you get the rash, we consider that to be chickenpox. And then when that goes away, and if you end up having a rash later on related with that same virus, then we call that shingles. Diagnosis is usually based on your history and physical exam. So usually, again, it's that story of I noticed a lot of burning, tingling, or pain, and then all of a sudden I developed a rash. And on exam, we see that it's only located on one dermatome or one side of the body. We also do cultures, but that's pretty rare to do cultures just because the only time we do that is if we're not sure if it's still shingles anymore, then we may go ahead and get a culture, but it's very unusual that we get cultures just to confirm if it's shingles. The most common complication related with shingles is what we call post-herpetic neuralgia. What that is severe pain after the rash clears, and that really is what bothers a lot of people, is that they get shingles and the pain can last anywhere from weeks to years after being exposed or having reactivation of the shingles. Usually with that, it's just pain management with nerve medications. And what are some of those medications that we use? A lot of it can be medications such as gabapentin or Lyrica, which we use a lot for pain management, even for depression as well too. but also for nerve pain related with shingles. We also will, if you think you might have shingles and you come in and we confirm it, we may prescribe what we call antiviral medications. So the most common one that you hear will be acyclovir or valcyclovir. It really depends on what your insurance covers, and depending on that is what we order. But those can reduce the severity and duration if you do have shingles. And so if you suspect you might have it, as long as you come in within 48 or 72 hours, it can help reduce the severity. Besides the nerve medication, some of the other pain relievers that we may prescribe would be lidocaine to numb up the area if it's pretty painful. And then antihistamines such as Benadryl, Zyrtec, Claritin, or Allegra to help with itching as well, too. We don't see a whole lot of itching. What we see a lot of is mostly pain related with shingles. Prevention, how do you prevent it from spreading to other people? Well, if you're diagnosed with shingles, we ask that you keep the area clean and dry and covered. Avoid scratching it, especially when it's in the blister stage, just because, again, that's when it's most infectious. Also, make sure you wash your hands often and avoid pregnant women, premature infants, and people with low immune system or people who are elderly, just because, again, they can, get reactivation, or if they've never had it, be exposed to it. And then, of course, shingles vaccine. So this will be an update to the shingles vaccine. So just a little bit about the old shingles vaccine. The old shingles vaccine is called Zostavax. It was a single dose, and it was a live vaccine. And it was approved for patients above the age of 50. The CDC doesn't recommend it before the age of 60, and so most insurance will only cover for people above the age of 60. Unfortunately, there's no long-term studies with protection in this age group between age 50 and 60, so that's why it's not recommended by the CDC. And then in terms of efficacy, beyond 5 years, it's not clear whether or not it's as effective anymore. The other thing about the old vaccine was that it was only about 51% effective, so it wasn't that great of a vaccine, but it was something. On top of it, too, there's only certain groups of people that can receive it. So if you were on medications that led to low immune system or have active cancer, then we wouldn't recommend the vaccine. So the new vaccine, however, is actually a lot better. You can pretty much give it to anybody. So even if you have active cancer or on medications that lead to low immune system, you can still get this vaccine. It's actually 2 doses given about 2 to 6 months apart. It's a dead vaccine, which means it's similar to like the flu vaccine or the pneumonia vaccine. And in terms of how effective is it, it's actually more effective compared to the old one. So in the age range of 50 to 69, it's about 97% effective. And patients above the age of 70, it's about 91% effective. The only unfortunate thing is that no one expected that this vaccine would be so popular, but there's a nationwide shortage, so it's really hard to get. So what we're running into problems with is that people get the first vaccine, but then the second vaccine, they're waiting months to get. So that's been a problem of getting the vaccine. People ask, well, I've had the old vaccine. Can I get the new one? Yes, you can still get the new one. If you just recently had the old vaccine, Zostavax, then usually we say wait 2 months or 8 weeks before getting the new shingles vaccine. Saying that, they are getting rid of the Zostavax, so that's not in production anymore, so everybody's going more towards the new shingles vaccine called Shingrix. What are some of the side effects of the new vaccine? Pretty standard compared to other vaccines where you can get a lot of redness and soreness at the site where you get the injection. Itching, swelling, headaches. That's been a big one where we've noticed patients getting headaches after receiving the first initial vaccine. Stomach upset, shivering, muscle pain. And another one that I didn't have on here that we've noticed patients been experiencing is flu-like symptoms about 2 to 5 days after the injection. So that's something to watch out for, but can be common and something that we've noticed patients have had with the vaccine here at the clinic. Let's see, who should not get the Shingrix or shingles vaccine? Anybody who's pregnant or has had an allergic reaction to the first dose. What's the true allergic reaction? If you develop shortness of breath, throat swelling, facial swelling, or generalized rash afterwards, then we wouldn't recommend getting the second shingles vaccine. The other is that if you currently have shingles, we don't recommend getting it yet. Usually we say wait 2 weeks after the rash has disappeared, or for some patients I tell them wait about a month or two before you get the shingles vaccine. Regarding coverage, it really depends on your insurance, but if you're on Medicare, Medicare Part D does cover the shingles vaccine, but there might be a cost, and part of that has to do with your copay and what kind of coverage your plan has. If you're on Medicaid, it may or may not be covered. Private health insurance usually covers for that, but again, there may be some cost based on your copay. And so usually we ask that you check with your insurance first to see if it's covered. And if it is covered, also ask, is it covered in the clinic versus the pharmacy, because some insurance are pretty particular about where you get the shingles vaccine. So, for example, we've had some patients who call their insurance, and their insurance says it's covered, but it was actually covered in the clinic, but they got it at a pharmacy, and their insurance denied coverage for the vaccine. So very important that you ask where it's covered, whether it's pharmacy versus the clinic. The other is that there are vaccine assistance programs, and you can always call the pharmaceutical companies to see if there's any assistance with coverage. Usually it's GlaxoSmithKline and Kline that makes the Shingrix, so you can ask them about that. My experience, most of the vaccine assistance programs is only covered by private insurance. And so with Medicare, usually we find that there's no assistance with that at all. So very important to check with your insurance about coverage, as well as where is it covered, the pharmacy versus the clinic. And if it's covered, then always call and find out if they have it in stock, because unfortunately, like I said, there is a nationwide shortage. And here at the clinic, we currently do not have any vaccine available. And I think locally, there's very few pharmacies that have the shingles vaccine in stock. So just to kind of summarize, so the shingles is a reactivation of the varicella zoster virus, which is the same virus that causes chickenpox. Usually people will notice a rash after they experience some pain. Treatment, usually antiviral medications or medications to help with pain relief. And then there is a new shingles vaccine called Shingrix, which we recommend for patients above the age of 60. And always check, again, with your insurance about coverage with the vaccine. So that's the end of my presentation. Does anybody have any questions or? So it looks like we don't have any questions. If you do think of anything, feel free to contact us and we can try to address that. Otherwise, I will turn this over.
Yes, thanks everyone for joining us. Thanks, Dr. Lee.